Fever after Covishield vaccine. The new Covishield vaccine has been approved for use in many countries to combat the spread of the COVID-19 virus. However, there are some reports of fever after receiving this vaccine, and it is important to understand what this means. Fever is a common side effect of the Covishield vaccine. It typically occurs within 24 hours after receiving the injection and can last for several days. A person may experience chills, body aches, headache, fatigue, and/or increased sweating during this period. The fever usually resolves on its own without treatment or medical intervention, but if it persists longer than 5 days, then medical attention should be sought out immediately. Causes, common side effects of COVID-19 vaccine. The most common side effect of the Covishield vaccine is a fever, which may occur within 2 days of receiving the vaccination. Other potential but less common side effects include joint pain, headache, fatigue, and body aches. The main cause of these symptoms is believed to be an immune response that occurs in some individuals after receiving a vaccine. Symptoms: heat, sweating, and fatigue. Fever is a common side effect of the Covishield vaccine, which can cause symptoms such as heat, sweating, and fatigue. Heat is one of the most common symptoms associated with fever, causing a person to feel hot when their body temperature rises above normal. Sweating is another symptom that can occur due to the increase in body temperature. As the body sweats more than usual, it may lead to dehydration and discomfort. Fatigue is also a symptom of fever after receiving a Covishield vaccination. It can be difficult for someone to concentrate or focus on tasks at hand when they are feeling fatigued from an illness or situation like this one. Diagnosis, blood tests and imaging tests. Diagnosis of a fever after a COVID-19 vaccination is usually done through a physical exam and medical history. Blood tests are also commonly used to help diagnose the underlying cause of the fever. These tests can include complete blood count, CBC, comprehensive metabolic panel, CMP, and liver function tests. Imaging tests may also be used to assist in diagnosis, including chest X-rays or computed tomography, CT, scans of the chest, abdomen, and pelvis. Treatment, medicines and rest. Treating a fever after receiving the Covishield vaccine is straightforward and can be managed with medicines and rest. Medicines such as ibuprofen or acetaminophen can help reduce the fever, while resting in a cool environment may also provide relief. Additionally, it's important to stay hydrated by drinking plenty of fluids like water or electrolyte drinks. Therefore, it is best to consult your doctor if you develop any severe symptoms following the shot. If left untreated, a fever may continue for several days and result in dehydration or other complications. Prevention for COVID, vaccination. Prevention is key to reducing the severity and risk of illnesses such as fever after Covishield vaccine treatment. Vaccination is one of the best ways to protect yourself from serious diseases. Getting vaccinated can help you avoid getting sick, and it also has the added benefit of protecting those around you who may be more vulnerable to infections. The Covishield vaccine is a safe and effective way to prevent fever after Covishield vaccine treatment. Health professional advice for Covishield vaccine. Fever is a common side effect of many vaccinations, and this includes the Covishield vaccine. It is important to note that a fever can be an indication of an adverse reaction to the vaccine, so it is important to stay vigilant while monitoring your symptoms. Patients should contact their doctor or healthcare provider if they experience any new or worsening side effects after receiving the Covishield vaccination. Conclusion: seek medical help for Covishield. Fever after receiving the Covishield vaccine is a fairly common side effect. It usually manifests itself within 1 to 3 days after the injection and can last for a few days. It is typically not too severe and generally does not require any medical help. However, if fever persists or becomes more severe, it may be wise to seek medical advice from your doctor or healthcare provider.